Hello friends, let us now learn about lateral X-ray. Now, in the lateral chest X-ray, when do you think the lateral chest X-ray is useful? Okay. So, when do you think the lateral chest X-ray is useful? One, it is useful to check whether equivocal frontal chest X-ray shadow is present or not. That means whether the findings of frontal chest X-ray are similar or not. Whether the findings of frontal chest X-ray correlate with lateral chest X-ray or not. Second, to know the position of abnormality. Like for example, whether the abnormality is anterior or posterior. Because we cannot say whether the abnormality is anterior or posterior based on the anterior chest, based on the normal chest X-ray. Then, to know which lobe is it in, to find the exact lobe, we have to do a lateral chest X-ray. Okay, so these are the main reasons why we need lateral chest X-ray. One more important thing about lateral chest X-ray is that in lateral chest X-ray, we can check the tricky areas in frontal chest X-ray. What do you mean tricky areas? Tricky areas are those areas which are not visualized on a frontal chest X-ray. Like for example, area behind the heart. If you see, the area behind the heart is not visualized in frontal chest X-ray. So for assessing the area behind the heart, we should do a lateral chest X-ray. Okay. Similarly, to find out in front or behind the hila, if there is any opacity, in order to find out whether the opacity is behind the hila or in front of hila, we should do a lateral chest X-ray. Similarly, to find out whether there is anything behind the domes of diaphragm, you will have to do a lateral chest X-ray. And also, in order to find out about the epiphysis, also we should do a lateral chest X-ray. So these are hidden areas of the lungs, which are tricky areas in the frontal chest X-ray. In them, we should do a lateral chest X-ray. Okay. Then, how do you do a lateral chest X-ray? In a normal individuals, we will have to keep the arms are held high up like this, and these arms are held high up and they are held away from the thorax. These arms are held high up and away from the thorax in for a lateral chest X-ray. Then, similarly, if the patient is old, if an elderly patient or a frail patient, then the patient will have difficulty in putting the arms up. So as a result, in such patients, arms are in such patients, arms are positioned in front of the chest. They are put in front of chest. Okay, so this is one more important thing. Sometimes these arm shadows can also mislead the diagnosis, which should be kept in mind. Then, always remember the arm should be put up like this in order to avoid the scapular shadows. So here you can see these are the scapular shadows. Similarly, in this picture, if you see in this picture also, you will be able to see these as scapular shadows. These are also the scapular shadows which are seen. This is one shadow, this is other shadow. So these are scapular shadows which are generally seen in a lateral chest X-ray. Next. Now, in the lateral chest X-ray, if you have to understand the lateral chest X-ray, first and foremost, you see that the bones in the lateral chest X-ray. In the lateral chest X-ray, we have the sternum and we have the vertebrae. Okay, the lungs are seen here. And also you will have to add the heart, which is seen, and you will also see the aorta, and you will also see an IVC and aorta coming like this in a lateral chest X-ray. Similarly, you will see this is actually right pulmonary artery. This red one is right pulmonary artery, you can see. Similarly, you can see here you will have left pulmonary artery. Okay. Similarly, if you now add the fissures, so if you have to name the fissures here, so we have oblique fissure and lateral fissure. These are two lungs, oblique and lateral fissures. You can see oblique and horizontal fissures can be seen. So these are fissures. Then followed by it, then this is trachea which can be added. So at the end, we get this normal chest X-ray. So this is the heart, vertebral body, sternum, and you will have the arch of aorta and inferior vena cava and aorta which are seen here, and all these are lateral chest X-ray. Right. So this is normal frontal chest X-ray where you can see these things. This hyla. In the hyla, if you see, this is right pulmonary artery. Okay, this is left main. This is right main pulmonary artery. Similarly, we have left main pulmonary artery. Here you can see the right upper bronchus. The right upper lobe bronchus is seen here. Similarly, this is left upper lobe bronchus. So this is the labeling in the frontal X-ray, chest X-ray. Now again in the lateral chest X-ray, if you actually visualize this diaphragm in the lateral chest X-ray. So if you see the diaphragm in lateral chest X-ray, both the diaphragms, like left and right dome of diaphragm, both the right and left dome of diaphragm can be seen separate from each other. Two domes are easy to separate from each other. Number one. So here we have, this is the right dome which is seen from the front to back like this continuously, whereas this is the left dome. Okay, if you see right dome, this right dome is visualized completely like this from front to back. So right dome is visualized mainly from front to back, completely it is visualized. Whereas if you see the left dome of diaphragm, this left dome of diaphragm is not visualized completely. If you see, this is the left dome of diaphragm, which is only visualized up to the cardiac shadow. Left dome of diaphragm from cardiophrenic angle, sorry, from costophrenic angle. This is from costophrenic angle, or you can say costophrenic recess posteriorly to posterior part of the heart, or to the cardiac shadow, to the back of cardiac shadow anteriorly. To the back of cardiac shadow anteriorly, you can see the left dome of diaphragm. So we have both right dome of diaphragm and left dome of diaphragm which can be seen in the lateral X-ray. Next. So this is about the domes of the diaphragm. Then sometimes if you see, it is very difficult to separate the domes of diaphragm. Sometimes separation of domes of diaphragm is very difficult. Why? Because sometimes the domes may overlap each other completely. Whenever the domes overlap completely, then obviously you cannot see the domes separately. Then, if the base of the heart is narrow, if base of the heart is narrow, then obviously there is obliteration of the anterior. Here the anterior part of the left dome is obliterated by the cardiac shadow. But if the heart is narrow, then obviously this left dome will continue like this and it may overlap with the right dome of diaphragm, thus resulting in this both domes of diaphragm seen together instead of being seen separately. Then if you see the in the lateral X-rays, if you see the hyla, followed by that in the lateral X-rays we have hyla. The hyla, in the hyla you will see that 95% of times you will see presence of pulmonary artery and pulmonary veins are seen at the hyla. So if you see this picture, so here you can see the main pulmonary arteries are seen in the picture. So this red one is actually right main pulmonary artery which is seen, whereas this is the left main pulmonary artery. Okay, we can see the right and left main pulmonary artery in the hyla of the lung. So some of the left and right hilar densities can also be seen on lateral X-ray. Then we have lung fissures. In the lung fissures, in the lateral X-ray, if you see, this is the horizontal fissure which is easily identified in the lateral X-rays. Then we have oblique fissures also. Oblique fissures are somewhat like this. And here the oblique fissure, this green one is right oblique fissure, whereas this blue one is left oblique fissure. So these fissures will divide the lung into the respective lobes. Then this is the oblique fissure configuration which will resemble the aeroplane propeller. Now, so one thing is, if you see here, this is the right oblique fissure. So you take this. So if we see the okay, if you see this is the okay, this is the horizontal fissure, right oblique fissure, and left oblique fissure. Now the right oblique fissure is at the this lies 4 to 5 centimeters posterior to the sternum. Number one, okay, this right oblique fissure is just present posterior 4 to 5 centimeters posterior to the sternum. Okay, that is number one. Whereas left oblique fissure is positioned more posteriorly. It is present more posteriorly. So this variation of right and left oblique fissures can also be seen in this X-ray. In the lateral X-ray, we can also find which is right oblique fissure, which is left oblique fissure, and their differentiation is also easier and can be done in the lateral chest X-ray. Next. Next, we have angles. We have to know about the postophrenic angles in the lateral chest X-ray. Postophrenic angles will have recesses and sulci. If you see the lateral chest X-ray, in this lateral chest X-ray, so this is the postophrenic angles. So posteriorly, this is posteriorly, inferiorly of each lung, you can see presence of postophrenic angles. Okay. In the lateral chest X-ray, each postophrenic angle will be the inferior aspect of the lung. So these postophrenic angles are the most inferior aspect of lung and pleura. These are the most inferior aspect of lung and pleura. So this is one postophrenic angle, this is the other postophrenic angle. Okay, next. Next, if you see the lung epices, with the help of the lateral chest X-ray, see, in the lateral chest X-ray, the lung epices are actually free. Normally, in the if you actually see this normal chest X-ray, if you actually see this normal chest X-ray, this is the normal chest X-ray. Okay, here you will see that epices are covered by ribs. Epices are covered by ribs and bony spaces. Actually, they are covered by bones. So it is very difficult for us to find the lesions in the apex in the normal frontal chest X-ray. But here in the lateral chest X-ray, it is very easy. It is not much easy. Even in lateral chest X-ray also, sorry, it is not easy. Because of soft tissues, not easy to find the lesion because of soft tissues. Because even in lateral chest X-ray, we are having soft tissues, or shoulder may be present, or chest wall may be present in the lateral chest X-ray also. So it is also difficult in lateral chest X-ray also to find the epices. Next. Next we have retrosternal line. So in the retrosternal line, if you see, a soft tissue interface with lung is visible behind the sternum. Behind the sternum, this retrosternal line, this is a line which is present behind the sternum, and this retrosternal line is a soft tissue. It is present between the soft tissues and the anterior aspect of right lung. Between the soft tissues and anterior aspect of right lung, we have this line called as retrosternal line. So this is retrosternal line which is seen normally. But here if you see the retrosternal line, because of the sternal fracture, this retrosternal line, it bulges posteriorly. Okay, it is bulging posteriorly. Here there is sternal fracture. Because of the sternal fracture, the retrosternal line is bulging posteriorly. So, so these are the important aspects about lung in the lateral X-ray. Thank you.